Hello friends, this is a latest research report that is opportunities for chronic pain self-management, core psychological principles and neurobiological underpinnings. Chronic pain is a pervasive global health issue that significantly impairs quality of life and imposes substantial socio-economic burdens. Traditional pharmacological treatments often provide limited relief, as we all know, and may lead to adverse side effects, of course, underscoring the need for effective self-management strategies. That means we need to have self-management. We should give more importance to self-management than relying more on psychopharmacological therapy. This I am stating a 2025 study by Lean Weiss, Tor D. Weger, and Christopher Eccleston, published in the Lancet, explores the integration of psychological principles and neurobiological insights to enhance chronic self-pain management. The psychological foundations of self-management. The authors, the research, those who conducted the research, they say, emphasize the role of psychological factors in chronic pain perception and management. Key psychological principles include cognitive appraisal. Individuals' interpretations of pain influence their emotional and behavioral response. Catastrophic thinking can exacerbate pain experiences, while adaptive appraisals can mitigate them. So we have to adapt to the pain. Second one is emotional regulation. Chronic pain is often accompanied by negative emotions such as anxiety and depression. Strategies that promote emotional resilience can improve pain outcomes. So if you are able to control the depression and anxiety like emotions, you will be able to manage your pain much better. The third one is behavioral activation. Engagement in meaningful activities can distract from pain and improve mood, creating a positive feedback loop that enhances overall well-being. So this also tells a story of your brain rewiring, or better we call it neuroplasticity. These principles align with established psychological therapies such as cognitive behavioral therapy, which have demonstrated efficacy in managing chronic pain by addressing maladaptive thoughts and behaviors. The neurobiological underpinnings of this study. Advancements in neuroscience have elucidated the complex neural mechanisms underlying chronic pain. The study highlights central sensitization. Persistent pain can lead to heightened sensitivity in the central nervous system, amplifying pain signals. Neuroplasticity. The brain's ability to recognize itself suggests that interventions can potentially reverse maladaptive pain pathways. Brain pain modulation. Areas such as the prefrontal cortex and anterior cingulate cortex are involved in pain perception and modulation, indicating targets for therapeutic interventions. Understanding these mechanisms supports the development of interventions that not only address psychological aspects but also aim to modulate neural pathways associated with pain. Integrative self-management approaches. The integration of psychological principles with neurobiological insights has led to innovative self-management strategies such as mindfulness-based interventions, practices that cultivate present moment awareness. We learn to be in the present, and this can alter pain perception and reduce emotional distress. The second one is biofeedback and neurofeedback. Techniques that provide real-time feedback on physiological process can empower individuals to moderate their pain responses. The third one is digital health tools. Mobile applications and online platforms can deliver personalized interventions, increasing accessibility and adherence. These approaches emphasize patient empowerment, encouraging active participation in managing their pain. The implications in clinical practice. The study advocates for paradigm shift in chronic pain management, moving from solely biomedical model to a biopsychosocial approach. Clinicians are hereby, in this study, we can encourage clinicians to incorporate psychological assessments into routine evaluations of chronic pain patients. So we also can include the psychological assessments in this particular procedure. Collaborate with multidisciplinary teams to provide comprehensive care. This multidisciplinary teams can include the CBT therapist, clinical psychologist, even counselors also can be. They can also play a good role in this. Educate patients on the interplay between psychological factors and pain, fostering self-efficacy. We have to teach patients how the psychosocial conditions negatively affect their pain. By adopting these practices, healthcare providers can facilitate more effective and sustainable pain management strategies. In conclusion, the integration of core psychological principles with neurobiological understanding offers promising avenues for enhancing chronic pain management, self-management. By addressing both the mind and the brain, these approaches can lead to more holistic and effective interventions, ultimately improving patient outcomes and quality of life. I am quoting the research report here. Thank you for watching this video.